As you know, Nevada is continuing to operate in Phase 2 of our Roadmap to Recovery plan, allowing our medical, public health, and emergency response professionals to evaluate and analyze new trends, including what is now a 4-week upward trend in new daily cases. We are still watching a continued increase in our confirmed and suspected COVID-19 hospitalizations as well. Recently, that number reached 439 cases in Nevada's hospitals statewide. However, patients requiring ICU beds and ventilator usage continues to hold steady. The Nevada Hospital Association is regularly evaluating the effects of COVID-19 on staffing, PPE supplies, and bed capacity. At this point, the Hospital Association continues to remain confident that they can serve the needs of all Nevadans. I want to take a moment to remind everyone where we've been. Our goal for Phase 1 was to flatten the curve. Nevadans responded to the challenge and were able to lift some restrictions. To go to Phase 2, our goal was to achieve 14 days of flat or decreasing positive test rate and hospitalizations. Many Nevadans acted responsibly, and after achieving those goals, we reopened much of our economy. While there continued to be some limitations, bars, restaurants, beauty salons, and many other businesses brought their employees back to work and opened their doors. A short while later, we were able to reopen our state's primary industry, tourism. At that time, I told Nevadans to stay open and remove further restrictions. We had to accept our personal responsibility to keep our workers safe, our families, and ourselves. At that time, I mandated that Nevada businesses and employees who interact with the public wear face coverings, and continued to strongly encourage members of the public to wear face coverings as well. Unfortunately, as you can see from the data that I've presented to you in the numbers, we've taken some steps backwards. Clearly, for many, the excitement and enthusiasm from escaping from our confinement and finally being able to enjoy dinner out with our families, buy new clothes, or get a haircut overshadowed the good judgment we practiced in the previous months. Unfortunately and inexcusably, I also made an error in judgment while out to dinner with my wife, where I was photographed not wearing a mask. It was an error and it was inexcusable. Too many Nevadans have had the same lapse of judgment. Every hour, there are photographs, videos posted of large, unmasked clusters of people, clusters of potential COVID-19 spread. So I want to put it to you like this. If back in March, before we shut down the vast majority of our economy, if I'd have said to you, we can keep our economy open if everyone agrees to wear a mask and maintain 6 feet in person-to-person distance separation, who would have not accepted that offer? Well, that exactly is what needs to be considered today. I don't know why, but when protecting our health and our neighbors' lives became a political, partisan, or even philosophical decision. For me, it's none of those. It's a medical necessity, a human obligation, and it's good for business. Study after study, worldwide, every notable medical professional, from President Trump's top advisor, Dr. Fauci, to all of our Nevada medical professionals, assert one unassailable conclusion: wearing face coverings save lives. Period. End of story. In fact, one study highlighted by my medical advisory team showed that replacing our strict lockdown with social distancing alone, without universal masking, results in an unchecked spread with potentially devastating results. It showed that when at least 80% of a population adopts universal masking, it results in a substantial reduction of infection. On the other hand, masking at only 50% of a population is not sufficient to prevent continued spread. We owe it to each other. We owe it to each other to accept the fact that wearing face mask coverings saves lives. We owe it to the many workers, the healthcare professionals, retail clerks, restaurant workers, grocery store employees to accept that fact as the truth. We owe to Nevada's many businesses, large and small, to accept that fact. My fellow Nevadans, I'm offering us all another opportunity to limit our risk for exposure and infection and to keep our businesses open and our economy moving forward. For Nevada to stay safe and to stay open, we must make face coverings a routine part of our daily lives. That's why today, at the recommendation of the medical advisory team, I signed a directive with a new requirement for Nevadans and visitors to wear a face covering, their nose and mouth with a mask or face covering when in public space, whether publicly or privately owned. The directive is effective on Friday. Really, it's effective Thursday night at 11:59 p.m. to give businesses one day to get ready. We understand that the situation in some areas of the state is not as bad as it is in others, and we want to keep it not bad in some of the areas of the state. We recognize that as well as all of the work that everyone across the state has been doing, however, we see a spike in positive cases, and we need to ask everyone around the state to do their very best to keep everyone else and all of us safe. This especially applies to indoor activities in which you are near other people, including grocery stores, retail businesses, malls, and gaming properties. Detailed guidance is currently available online at nvhealthresponse.nv.gov. There are, of course, exceptions to this directive. For instance, those with medical conditions that make it difficult to breathe, those with a disability that prevents them from wearing a face covering, and young children between the ages of 2 and 9 are exempt from this requirement. However, they are still strongly encouraged to wear a face covering as much as possible. The full list of exemptions is outlined in the guidance online. I encourage all businesses to prominently post signage to alert customers and help ensure this directive is followed. I know there are some businesses who have already required face coverings for their customers, and I thank you all for this strong and helpful stance. Businesses that fail to meet requirements in this directive will face violations from local licensing agencies and regulatory authorities, in addition to Nevada OSHA. A reminder as well that businesses have the right to ask any patron to leave if they are not following this directive. I call on local governments and regulatory authorities to help ensure there is education around this directive for our businesses and subsequent enforcement through the appropriate bodies if compliance is not met. But it's not just on the business or state and local government. It's on all of us as well. I'm asking individuals throughout Nevada to take this seriously and understand the risk you're posing on yourself and others by not wearing a face covering. And I know there are probably a lot of questions about additional enforcement measures for individuals. I want to be clear. This is a mandate, so enforcement language is necessary. However, ideally, there won't be any criminal civil sanctions for individuals. The last thing I want is for monetary fines or criminal penalties to be imposed on Nevadans, which is why I strongly encourage everyone to follow this directive. Nevada is a state that prides itself on its fierce individualism. It's part of what makes us great. So I'm asking all of us to take our independent spirit and turn that into our individual responsibility to keep the lights on for businesses throughout our state. I believe there are more good than bad in this, but I know that we've all seen the concerning pictures of crowded spaces since reopening. They may appear anecdotal for now, but due to our increasing efforts in contact tracing, they won't be anecdotal for long. Increased contact tracing capacity will continue to help us know where and how people are contracting this virus, and we'll soon be able to pinpoint industries and businesses where people who are already at higher risk are becoming infected with the COVID-19. Our contact tracing makes that possible. I don't want to have to take steps backwards by imposing stronger restrictions on individuals identified as high risk if I don't have to. And the best way to prevent this is to not let a business type or industry become high risk in the first place. It's on all of us, Nevadans. To be clear, due to the data and time needed for evaluation of contact tracing and impacts of this new face covering directive, any discussion of entering phase 3 will be tabled. The pandemic is not over. As I said last week, we are not post-COVID. We're still in the middle of the first wave of COVID. So please, I cannot emphasize this enough. Wear your face covering anytime you leave your house. When you go to a restaurant, when you stop at the pharmacy, when you enter a casino, wear your face covering. You don't need to wear an N95 mask like my medical professionals wear. The medical advisory team and CDC recommended homemade fabric face coverings of all type. They're easy to be made, and they can be made from cloth or fashioned out of something as simple as a bandana or an old t-shirt. Options for doing so have been linked to in our guidance. There are several additional resources online. Let's all work together to stay safe and stay open. No shirt, no shoes, no mask, no service. I know Nevadans are worried not only about their health care, but also about their jobs and commerce. They keep asking me and my team, what can I do to help? You can do this. Everyone can. This simple act is not only a way for us to save lives, but also a way for us to save our Nevada's economy. And while I call this press conference to discuss face coverings tonight, I also want to give you a quick update on our state budget. After all, our state budget and economy have been directly impacted by the public health crisis. As you know, the COVID-19 pandemic has caused budget shortfalls for both the 2020 fiscal year and the 2021 fiscal year. Major actions to address the budget shortfall in fiscal year 2020 included the transferring of the rainy day fund, reversing one-time appropriations and capital improvements, and reducing the operating budget by approximately $67.5 million. These were approved by the Interim Finance Committee on June 12th. That brings us to the projected shortfall for the fiscal year 2021. The latest revised revenue projections developed jointly by the Fiscal Analysis Division and the Governor's Finance Office reflects a total general fund shortfall estimated at approximately $1.27 billion. This is approximately 25% of our annual operating budget. We anticipate general fund revenue collections for April business activity will be released in the next few days, at which time the projected shortfalls for both fiscal year 20 and fiscal year 21 will be updated in final actions for both of my budget proposals can be finalized with the most up-to-date numbers. Here's what I want to emphasize before I wrap up. This is not a normal recession. The state went from its economic peak to its economic trough in a matter of weeks. As a result, tough decisions had to be made to save lives. Revenues may very well recover faster than expected if the coronavirus were to subside due to responsible actions by all of us, or if a treatment would become available earlier than anticipated, or if revenues recovered more slowly and a second wave slows the reopening of our economy. Unprecedented, historic, uncharted. All of these words fit our situation, and it would be irresponsible to release every minute-by-minute revision of this budget proposal without proper vetting by our fiscal experts and before receiving our latest revenue numbers, with the hopes of reducing the potential dramatic impacts to our state budget. I look forward to receiving these numbers and making any final adjustments to fiscal year 21 budget proposal so I can share it with all of you. Finally, I want to acknowledge some amazing Nevadans. Back in April, my office launched the Hero of the Day campaign, recognizing Nevadans that have gone above and beyond to help their fellow citizens in response to the COVID-19 pandemic. We recognized medical professionals, first responders, school teachers, grocery clerks, citizens standing up, donation drives, serving food, and many more. As the state continues to reopen, I'm excited to launch a new campaign tonight to recognize Nevada businesses that are following directive guidelines to stop the spread of COVID-19. Tonight we launched the Battleborn business campaign to highlight the businesses taking creative and safe measures to stay safe and to stay open. Please send nominations with a photo and brief explanation for the nomination to Battleborn Biz Nevada, that's Battleborn BIZNV, at gmail.com. That's Battleborn BIZNV at gmail.com. At this time, I'd like to take a moment to recognize some great Nevadans. My staff and I have briefed numerous business leaders, medical professionals, gaming executives, and labor groups. From chambers of commerce to construction workers to gaming executives to hospitality employees, I want to thank you for your understanding, your support, and your commitment to our shared mission. Keeping Nevada open, keeping Nevada strong, and keeping Nevadans and our guests as safe and healthy as possible. I'm asking Nevadans tonight to unify in an effort to move forward. Republicans, Democrats, nonpartisans, left and right, business owners and workers. Let's do what's necessary, not only to keep our economy open, but hopefully to allow us to go full throttle in the future safely and successfully. Anything less than our total commitment will lead to the terrible consequences we've all seen in other parts of our nation and the world. Thank you for your attention, and I now will be happy to take some questions.
As a reminder, if you could come up to the podium and make sure you hit the button so the microphone's on, and let's try to keep it to one question at a time so we can get through as many as possible.
Thank you, Governor. Thank you, Governor.
Thank you.
As far as benefits go, there are many people who don't qualify for regular unemployment because their W-2s show small amounts of, say, $100, and that system doesn't allow them to file, but then they have issues receiving PUA benefits when almost all their pay falls under self-contractors. What are they supposed to do after a month of the system being up and they're not receiving anything? They keep being told Dieter is working on it. Is there another answer to give them at this point for some guidance?
Unfortunately, there is not another answer. Dieter is working around the clock to resolve these issues. We've gotten to as many of them as quickly as we possibly can. Unfortunately, the ones that are still having trouble are usually an isolated case that they have a specific instance, like you're saying, regarding their wages or whatnot, and they have to be handled on a one-at-a-time, case-by-case basis, and working through them as fast as we possibly can.
Is there any way to speed that up, that process?
We are working through them as fast as we possibly can. They have to be done individually, and it can take 30 to 60 minutes to do one claim, which means we've got folks that are in there, they're doing 12 claims a day. That's all that they can get through a day. And we've got people that are using robocalls to call into Dieter's office, which is jamming the phone lines so other people can't get through, and it's making the problem more complicated. So we're getting to them as fast as we can.
Thank you.
When it comes to the contact tracing, do you guys have any data yet that talks about the protests and some of the businesses that have opened? And then if you do get some of that data pertaining to certain businesses that are opened, would you roll back some of the regulations or anything like that?
Go ahead.
I'll start with the contact tracing and the data. So we are analyzing the data related to this. We've added special questions to our survey so that when we do case investigation, we can track if they've been to a mass gathering, if so, which mass gathering. So we did pull data from June 4th to June 16th, and we recalled all those cases, so appreciate the patience of those cases who were called. Approximately 11% had been to a mass gathering and 12% had been to a civic activist event. So that's something that will be part of our normal screening, and hopefully can provide more updates on that on an ongoing basis.
And with possible rollbacks, would that be possible if it
Well,
turns out businesses are?
I'd hate to roll back an entire industry, but as we do, if we find out that, for example, bars are a lot of causing a lot of this, or if it's another activity that might be causing some of the surges, we will definitely consider taking action in those specific areas and probably have to make some adjustments.
Thanks.
Thank you.
I'll just add that we did also include now occupation on our case survey, so we will be getting data on occupation as well as places visited. So we should have much more robust data so that you can look very specifically at those things.
And just a reminder for the press coming to the podium, make sure you hit the button so the microphone comes on. Thank you.
Hello?
Okay.
Okay. Governor, we're about a week out from the first of the month. Can you offer people any assurance that they're not going to get evicted in 1 week? Can you say anything about when the eviction moratorium is going to
We're going to be
expire?
addressing the expiration of the moratorium in the next few days. We're still gathering some data and talking to some of the groups that are involved in this, and we should have an update for that in the next couple of days as it relates to the eviction moratorium.
Do you expect there will be some sort of ramp down for folks that haven't gotten paid their unemployment checks and just have no money for this?
Well, there's a lot of anecdotal stories about individuals that have got unfortunately haven't got their POO or their UI, and definitely something that we're considering, and we will have a phased-in or rollback approach as it relates to the moratorium on evictions.
Can you say when you guys will be able to provide details about the plan?
Since it expires at the end of the month, it would be in the next few days that we'll be able to do that. I'm guessing the next 3, 4, 5 days.
Thanks.
Thank you.
This button? Hi, Governor. You said the last thing you want to do is impose monetary penalties on people for not wearing masks, but just to be clear, is that what this order does? And will that enforcement require more policing?
This order is a mandate for folks to wear masks. The mandate is put on individuals and on businesses. We're hoping that they will understand the severity of the situation and voluntarily wear masks. It works. I mean, every responsible medical professional will tell you a mask helps reduce the spread of an infectious disease. Anyone who's denying that is just denying reality. So we will do an education, and we encourage businesses to comply, and we will use local business regulating agencies and state OSHA to go in and make sure that businesses are in compliance with this directive. And if they're not, they will face appropriate penalties.
Well, I understand the hope in regards to individuals, but if anyone out of the more than 3 million people in the state doesn't wear a mask, will that be enforced via monetary penalty or another way?
I would hope that we would not get to that point where I have police officers walk around with a ticket book for people. That's not what the intent of this is. And you're always going to get people that are going to say, what about this one person that's not wearing a mask? I want to get to the 95% of the people that understand it's in their best interest. If you're young and you're healthy, it might be okay for you, but you could be asymptomatic and you're spreading it to someone else. It's important that they understand that other people wear a mask for you. You wear a mask for other people. We need to do a better job helping people understand this. It is troubling and it's really discouraging that this has become a partisan issue about whether or not people want to wear masks. This isn't about partisanship. It's not who you're going to vote for president. It's not about your rights. It's not about, this is about protecting the health and well-being of everybody that you come in contact with. That's what we're talking about.
And we're going to keep moving with the questions. We've got a line of folks, so one question at a time, please.
Hey, Governor.
How you doing?
Good.
Good.
I'm curious how much of this latest increase in cases might be attributable to the fact that we're just testing a heck of a lot more people now than we were.
Okay. Increased testing is not the sole responsible reason for our numbers going up. This right here has a lot to do with why numbers are going up. People aren't wearing these. That has a significant impact. The other thing that has had an impact, and it's on the positive side of the impact, is the contact tracing that we are doing. It works. If we test 100 people, that just at random, you test 100 people, you might get a positivity rate of 2, 3, 4% on those 100 people. But if you're testing 100 people that were identified through contact tracing, you're going to get a much higher rate because they were traced to this person. For example, if you got it, you were infected, and you identified that you were with Megan and 10 other people, and we tested those 10 other people, there's a more likelihood that they could have gotten it from you. And that's why some of the people are testing positive.
Okay, but what percentage, again, of the increase in cases do we think is attributable to just testing more, doing contact tracing better, that sort of thing,
I think-
as opposed to masks?
I think Ms. Peak can give an answer to that question, and then we will move to the next person.
So I don't have that information with me right now, but I'll say we know the equation to prevent it. We also know the equation to spread it. And so all of us can walk around the community and see people without masks, people indoors, close together, and we know that's how it spreads. So now we know how to prevent it. And I'll also add, COVID takes up our entire lives now, across the news, daily discussions, and it feels so big. But it also ends up to be the individual behavior that's going to butterfly affect this. So as the governor mentioned, one person who's positive that gets in a car with 4 people, and those 4 people get it. And then those 4 people spread it to 4 more people, who spread it to 4 more people, who spread it to 4 more people. And it's attributed to that first case who got in a car with a group of 4 people. So it's really important to think about the individual when it seems like this huge pandemic and we as an individual can affect change. You absolutely can. And that's what we're seeing through contact tracing. It is the one person, and it spreads and it spreads.
Okay, thanks.
And I'm going to add that the biggest thing you see when you see the online and you've got the pictures in your paper and you see them on social media and you see 50 or 100 people crowded into a bar, nobody's wearing a mask, or they're walking through a mall and nobody's wearing a mask, that causes an increased spread. It's that simple.
Thanks.
Thank you.
Hi, Governor. I want to go back to Dieter for a moment. The director's departure on Friday, she cited threats to her personal safety, and that's happening in other parts of the country as well. Wanted to ask for your personal reaction to that. Also, are other staff, state staff, getting those kind of threats? And have you gotten threats?
I can't get into the details about our security plan. I've got my detail here with me, and we've got a whole team that tracks threats. It's unfortunate that Heather was put in this position, and sometimes people are just, I don't know if they don't think before they go online and say some of the things that they say or do some of the things that they do, but Ms. Korbulik should never had to go through what she went through, and we're doing everything we can to keep her safe and all of our state employees safe.
Timeline for replacement?
Hopefully relatively soon.
Thank you.
And we have time for a couple more questions for the governor.
Hi, so I know in the past you've been reluctant to enforce masks just because we've seen employees, workers get harassed, experience violence. Are you worried about workers in Nevada experiencing that, and what's in place to protect them?
Okay, I'm going to emphasize one more time that wearing masks should not be as partisan or an expression of your First Amendment rights or your philosophical views. I would hope that people would take this in the manner in which it's intended, to please wear a mask for everyone's safety. There have been incidents across the country. We hope that doesn't happen here. I encourage all businesses to, they've been mandated to have their employees wearing them. Some of them are doing a real good job of that, and they are going to face the repercussions of that as we continue on our contact tracing, and we get our enforcement agents out into the field to address this. But everyone is mandated to wear a mask.
I got it. And does that include law enforcement as well when they're out in public?
That'll be up to the individual law enforcement agency as it relates to safety or an occupation, and you can find that all in the directives that are posted online.
Wait, I'm confused. So they're not mandated to wear masks?
Okay, depending on when they're making stops and the enforcement of their job, some of the sheriffs and police chiefs have opined that there's a safety issue. And we're leaving it up to the law enforcement agency to make that determination as it relates to their specific job function.
What would
To go
that
to the next question, there have been folks in line. Thank you.
Good afternoon, Governor. According to COVID Act Now, it's a group of healthcare professionals, universities, researchers. It talks about contact tracing as of June. It says Nevada has 400 contact tracers with an average of 334 new daily cases. We estimate Nevada needs 1,670 contact tracing staff to trace all new cases in 48 hours before too many other people are infected. This means that Nevada is likely to be able to trace 24% of new COVID infections in 48 hours. All these lower levels of tracing, it is unlikely Nevada will be able to successfully identify and isolate sources of the disease spread fast enough to prevent new outbreaks.
I'll handle that one. So we use that same math to develop our plan for contact tracing. And so I could say right now our contact tracers are available 24, from 8 to 8, 7 days a week. And their contact tracing, they have time to address the cases and contacts that are coming in front of them. We also have around 300 folks through the Nevada system of higher education that will be coming on in the next couple of weeks. And I believe I did fill out that survey, and it was last month, and so that was accurate as of last month.
So do you need more? Do you need more tracers, and where would they go if they say, I'm really interested in doing that?
Great question. So I would encourage folks to look at the postings on our Nevada system of higher education job boards. I know the one for Northern Nevada is up and ready for folks to apply, so that's the best location, and then UNLV and then Great Basin College for our rurals are also recruiting.
Okay, thank you.
Yep.
Great, and thank you all for coming. Governor, do you have any closing remarks before we go?
No, I can take a couple more if you want.
Okay, Governor says you can take a couple more.
She gets,
Hi, Governor.
sorry.
The announcement that we're going to go to maybe a blended learning model, part virtual, part in person for schools, is concerning a lot of parents who are wondering how they're going to afford childcare and how they're going to be able to work. What are you doing to address those concerns?
Well, that's an issue that our superintendent, Joan Ebert, is dealing with our 17 superintendents in terms of how to handle that. They're going to come up with individual plans in consultation with their school boards and their parents and their teachers. And I support Joan's decision as it moves forward. That's something that they're working on.
Do you expect there will be an infusion of state money or anything to help build capacity for childcare?
There is no infusion of state money in the budget crisis that we're facing right now. I'm confident that Joan and the superintendents will come up with a plan that will work for everyone. Thank you.
And we'll do Sam as the last question here.
Okay,
Thanks.
last one. See, I got in trouble for taking 2 more.
Governor, New York, New Jersey.
Can you turn the mic on? Sorry.
Sorry, I think I turned it off.
Yeah, there you go.
Okay,
Now it's
cool.
on.
Got it. New York, New Jersey, and Connecticut have implemented quarantine mandates for visitors from high-risk states. I'm curious, given Nevada's tourism industry, what it would take for you to implement parallel mandates on tourists?
Well, I'm familiar. I know those governors from our National Governors Association meetings. Nevada is a state that's based on tourism. We're not going to get to that point because I'm confident that everyone is going to follow the directive and wear their mask, and we won't run into the same situation that they had there. I believe that if people are responsible, no shirt, no shoes, no mask, no service, we're not going to have that kind of an uptick, and we'll continue to welcome people from around the country and around the world into Nevada, and I want to compliment those businesses, especially the ones on the Strip and the businesses in Northern Nevada that have opened safely and are servicing their patrons, are creating jobs and helping our economy, and I want to expand that and help that continue to grow.
Thanks.
Thanks a lot. Thanks for being here, everybody. Appreciate it.